Your doctor stopping one of your heart failure medications might actually be good news. I know that's probably not what you were expecting me to say. When a patient comes to see me after being told their medication is being reduced or stopped, then they're almost always arriving a bit concerned, a bit frightened. They assume it means that something has gone wrong, or that their heart is worse, or that their doctor has given up on them. In most cases, the opposite is true, but here's the problem. Nobody explained that to you. Your doctor changed the prescription, maybe said a few reassuring words and sent you on your way, and now you're at home wondering what it actually means. So let's talk about this. I'm Dr. Jodie Ann Senior, a cardiologist and heart failure specialist. By the end of this video, you'll understand the main reasons a doctor might stop or reduce a heart failure medication, what each of those reasons actually signals about your heart, what questions do you ask so you're never left confused after an appointment, and the one thing that I want you to walk away doing differently. Here's something most heart failure patients don't realize, and it matters. Heart failure medications aren't set and forget. They are constantly being calibrated. Your cardiologist is always weighing the benefit of each of the medications that it is delivering against the possible side effects that it might be causing, the strain that it's placing on your kidneys, your blood pressure, your heart rate. That equation changes as your condition changes. The problem is that most patients come into every appointment with a fixed mental model. More medications equals more protection. And for some people, this is precisely the truth. Any reduction might feel like a step backwards, but that's not how it works. And holding that mental model means that every time your doctor adjusts your prescription downward, it might trigger fear, even when it shouldn't. The real issue isn't the change, it's the absence of an explanation. And that's what we're going to address right now. So think about driving on a motorway. When you first get on, you accelerate. You need to build up speed to merge safely with the traffic. You apply more fuel, more pressure until you're traveling at the right pace. Once you're cruising, you can ease off the accelerator, not because you want to slow down, but because the car no longer requires as much input to maintain the same speed. The conditions have changed. The intervention required has changed. That's very close to what might happen in heart failure medication. When you were first diagnosed, your heart was under significant stress. Your medications were started, sometimes several at once, to bring the hormonal and fluid overload under control, to protect the heart from further damage, to stabilize things. And then they were probably ramped up. And over time, if those medications are working, if your heart is responding, if your symptoms are improving, if your ejection fraction is recovering, the clinical picture changes. And what was the right dose at the beginning may no longer be the right dose now. Your doctor reducing a medication in that context isn't withdrawing support. It's adjusting the cruise control because the conditions have changed. Now, let's talk about the specific reasons that this happens, because they're not all the same, and knowing which one applies to you is important. The first reason is improvement. This is the best possible version of this conversation to have with your cardiologist. In a proportion of heart failure patients, particularly those with heart failure caused by a reversible trigger like a viral illness, or those who have responded exceptionally well to treatment, the heart actually recovers meaningful function over time. The ejection fraction improves to normal, symptoms resolve, and in these patients, there is a carefully managed process of medication reduction, sometimes called de-prescribing, to find the lowest effective dose, or on rarer occasions, to trial stopping a medication entirely under close supervision. If this is why your medication is changing, it is a genuine marker of progress. It means the treatment has worked. And this has occurred where the underlying cause of the heart failure is known and has now been resolved. The second reason is side effects. Some patients don't tolerate certain medications very well. Blood pressure that drops too low, potassium that climbs too high, kidneys that don't handle a particular drug at a particular dose. When this happens, your doctor may reduce the dose or switch to an alternative, not because the medication isn't needed, but because the dose or the specific drug isn't right for you. This is fine-tuning, not failure. The third reason is a change in your clinical picture that requires a different balance. As heart failure progresses or as other health conditions develop, the calculus around a medication can shift. A new kidney problem might mean your diuretic needs adjustment. A significant drop in blood pressure might mean one of your blood pressure lowering medications needs to be reduced temporarily or even ceased. These are responsive, individualized decisions, not signals that your cardiologist has run out of options. The fourth reason, and this one is worth naming honestly, is that occasionally a medication is stopped because there's no longer evidence of it providing benefit, or because guidelines have evolved. Medicine changes. What was standard practice 5 years ago may have been refined or replaced by something better. Your cardiologist keeping your prescription up to date with current evidence is a good thing, even when it involves stopping something you've been taking for a long time. So here's the one thing I want you to take from this video. One question. Ask it when you see your doctor changing your medication, whether they're adding something, increasing something, or stopping something. The question is, what are we hoping to see, and what will tell us whether this is working? That question does 3 things. It gives you a clear outcome to watch for. It tells your doctor that you understand that the medication management is a dynamic process, not a set and forget one. And it means you leave the appointment with a specific piece of information instead of a vague sense of unease. If your doctor is reducing a medication because your heart has improved, you'll know to watch for any return of symptoms as the dose comes down. If they're stopping something because of side effects, you'll know what the alternative is and what to expect. And if they're adjusting because of your kidneys or your blood pressure or heart rate, then you'll know what test results they're tracking or what observation to be looking for. One question every time. Let's bring this together. Your doctor stopping or reducing a heart failure medication is not automatically bad news. In many cases, it signals the opposite, that your heart has responded to treatment, that your body needs less intervention to remain stable, or that your care is being fine-tuned to what your specific situation requires now. What makes it frightening or concerning is the silence around it, the absence of an explanation. And that silence is something that you can address by asking the one question that turns a prescription change from a mystery into a plan. What are we hoping to see with this change, and what will tell us whether this is working? My free heart failure stage guide is linked in the description below. It includes the 4 pillars of treatment, your stage, and your ejection fraction explained, and a set of questions specifically designed to help you get better information at every appointment. Download it and take it with you next time. It's free. Subscribe for a new video every week if this is something that interests you, all designed to give you the clarity your appointment probably didn't have time to.